Alright, evening nursing students. We are going to do a presentation on blood transfusion.
This is Michelle Bryson,
Sally Sanders,
Augie Westerfield,
And Pat McCulley, and this is our presentation. Okay, the first thing we want to do is define what a blood transfusion is. And it is the introduction of whole blood or blood components into venous circulation. And then if you break down the blood, it's commonly classified into four main groups: A, B, AB, O, and of course it's Rh negative or Rh positive as well.
Purposes of a blood transfusion would be to restore blood volume after a severe hemorrhage, such as from a traumatic injury or complications of childbirth. Another reason, we need to make sure to restore the oxygen carrying capacity of the blood. And we also need to provide plasma factors such as anti-hemophilic factor or factor VIII or platelet concentrations which prevent or treat bleeding.
delegations. Since giving blood is a sterile technique and has technical complexity, blood transfusions should not be delegated to UAPs. The nurse can ensure that the UAP understands complications and adverse signs that can occur, and then the UAP can report those back to the nurse, and once that's done, the nurse needs to reassess their patient. In some states, only RNs can administer blood and blood products. That includes UAPs and LPNs.
equipment needed for blood transfusions. Well, first, we're going to need blood product from the blood bank. Units of whole blood, packed RBCs, or other components needed to administer the blood transfusion. Second, we'll need a blood administration set, such as Y-type blood transfusion tubing and an IV pump if needed. The infusion pumps are used when blood needs to be given at a very specific rate to prevent fluid overload. The saline bags we're going to need 0.9% normal saline, and bags that come in 250 to 500 milliliter bags.
Okay, you're also going to need an IV pole, a venipuncture set with 18 to 20 gauge needles or catheters. That is if one's not already in place. And if blood is to be administered quickly, you're going to need a larger catheter, so I guess you could go all the way down to a 16 gauge. And also alcohol swabs, tape, and clean gloves.
With preparation, you must make sure that the client has signed a consent before the administration of blood products. Make sure they understand all the aspects of this consent. You also need to have a 18 to 20 gauge needle. And remember, blood components are only compatible with normal saline. And explain to the client why they're receiving the blood. And before you start, you have to obtain a set of vital signs to make sure everything's in normal limits. After you finish, you give the client another assessment of the vital signs. But before you leave, you need to make sure that the client or family understands any reactions that could include shortness of breath, back pain, itching, chills, nausea, or any new unusual symptoms that they may occur.
Okay, here's a safety alert. Before initiating a blood or blood component transfusion, match the blood or blood component to the order, match the patient to the blood or blood component, and always use two-person verification process.
Before initiating a blood or blood component transfusion, it is safer to have one nurse read the information for verification to the other nurse. This avoids errors that can be made if both nurses look at the tags together.
Another clinical alert is normal saline must always be used when you're giving blood. If the client has an infusion of anything other, then you need to stop that infusion from flowing and flush the line with saline prior to initiating your transfusion. Or you need to establish an IV access additionally to that other site. And then solutions other than salines can cause damage to the blood components, so that's why only normal saline can be used.
Before beginning procedures, make sure to take the temperature and vital signs prior to, during, and following the blood transfusion. This is important to help detect if blood transfusion reactions are occurring. Also, verify the blood product and the client information at the client's bedside with another licensed healthcare provider. Whenever carrying the blood, gently rotate the blood bag to mix any components that may have settled before hanging the bag.
The procedure is you clamp the blood tubing prior to spiking the blood bag and the normal saline bag. Remove the covering of the injection port of the blood product and remove the cap from the spike at the top of the tubing. Insert the spike into the bag. This goes for your blood bag, your saline bag, and every bag afterwards that you change.
Now it's time to open the roller clamp between the drip chamber and the 0.9% normal saline bag. Squeeze the drip chamber and allow the filter inside to be completely covered with fluid. Open your roller clamp distal to the drip chamber and prime the tubing with the normal saline. Now close the roller clamp between the saline bag and the drip chamber. If using an IV pump, load the tubing into the pump at this time.
Next, you want to verify patency of the IV site if this has not already been done previously. Then you attach your IV tubing to the client's IV site. Open the roller clamp between the blood product and the drip chamber and begin the infusion. You want to establish the flow of blood product. This needs to be infused at a rate of 20 drops per minute during the first 15 minutes or per your agency's protocol. And it's important to start off slowly because this is when severe reactions to the blood can happen, usually within the first 5 to 15 minutes.
When infusing, stay with the client for as long as your agency recommends, and continue to monitor and document the person's vital signs according to facility policy. After 15 minutes, regulate the blood flow according to the physician's order. When the blood product has infused, usually over a 2 to 4 hour period, as prescribed by the physician, begin to flush the lines with normal saline. This clears the tubing and makes sure all the blood product has been administered.
Finally, for the procedure, you'll disconnect the IV tubing and saline lock the IV.
While initiating a blood or blood component transfusion, if there's a reaction that occurs, stop the blood and contact the physician immediately.
Post-procedure. Apply clean gloves, and if no infusion is to follow, clamp the tubing.
When finished transfusion, determine if the blood component bag must be returned to the blood bank or if the blood bag and tubing can be disposed of in a red biohazard container. Make sure to follow your agency protocol.
The IV line can be discontinued or capped with an adapter, or a new infusion line and solution container may be added. If the primary IV is to be continued, flush the maintenance line with saline solution. If another transfusion is to follow, clamp the blood tubing and open the saline infusion arm.
Now it's time for documentation. Record completion of the transfusion, the amount of blood absorbed, the blood unit number, and the vital signs. If the primary IV infusion was continued, record connecting it. Also record the transfusion on the IV flow sheet. You can record acute reactions such as fever, temperature, chills, hypotension, or delayed reactions such as unexplained onset of jaundice or unexplained elevations in liver function tests. Transfusion reaction workups. Send ASAP.